Have you ever wondered what your doctor really sees the moment you walk into the room? Sometimes it's not your blood pressure or test results that raise the alarm. It's something as ordinary as how you care for your teeth, your skin, or your feet. Tiny hygiene habits that seem harmless, but may actually be quiet warnings of something much deeper happening inside your body. And the truth is, most people over 60 don't even realize they're making these small but dangerous mistakes, day after day, year after year. But your body remembers, and so does your doctor. In the next few minutes, I'll walk you through 7 personal hygiene mistakes that doctors notice almost instantly because they often point to hidden illnesses long before symptoms show up on a scan. These aren't just cosmetic oversights. Fixing them could literally change the course of your health or even save your life or the life of someone you love. Now, here's what makes this even more important. This information isn't part of any standard checkup. It's not something you'll see in a glossy health magazine. Most of it isn't even taught in medical school. Yet, it may be the line between aging with strength and independence, or quietly slipping into conditions that steal your energy, your mobility, and your sense of self. Let me tell you about Harold. Harold is 75, a proud grandfather, retired engineer, and weekend golfer who thought he had his health under control. He stayed active, rarely missed his grandkids' baseball games, and never gave much thought to his daily hygiene because he believed he was doing just fine. But during a routine checkup, his doctor noticed 3 small signs, things Harold had overlooked, that pointed to a serious health issue developing in the background, one that had been quietly progressing for months. I had no clue, Harold later told me. I honestly thought I was doing everything right. If my doctor hadn't caught it when he did, I might not be here today. That conversation stayed with me. So today, I want to walk beside you through what Harold never saw coming. I'll show you exactly what to look out for, what to change, and how just a few simple shifts in your personal care routine can restore your confidence, protect your health, and maybe even add years to your life. Starting right now. Mistake number 1. Forgetting your mouth is the gateway to your heart. When was the last time you truly looked at your toothbrush? Not just picked it up, but really looked at it. Are the bristles bent and frayed? Is it older than 3 months? More importantly, have you ever thought of your toothbrush as a heart-protecting tool? Because it is. What most people don't realize is that your mouth isn't just about teeth or breath. It's a hidden front line. A neglected gum line can quietly leak harmful bacteria into your bloodstream, straight to your heart, your brain, your vital organs. Researchers at Harvard Medical School have confirmed what many doctors have seen for decades. When gum disease goes unchecked, it increases your risk of heart attack, stroke, and even dementia by up to 3 times. It's not just about losing teeth. It's about losing time, memories, and years of your life. Let me share the story of Sylvia. She's 68, a retired school teacher from Oregon. Kind, thoughtful, and like many of us, she ignored her bleeding gums for months. I just assumed it was normal at my age, she said. But it wasn't. During a routine checkup, her doctor discovered dangerous inflammation in her heart valves, caused by oral bacteria that had slipped through her gums and into her blood. He told her, if we'd caught this just a few months later, the damage might have been permanent. So what can you do right now? Start small. Check your toothbrush. If it's worn, replace it today. Even better, consider switching to an electric brush. It's been shown to remove over 60% more plaque than manual ones, according to studies from the University of Pennsylvania. Then, brush twice a day. Not just a quick swipe, 2 full minutes. Use a timer if you need to. Floss every night, no exceptions. And please, keep those dental checkups, even if you wear dentures. Have you noticed bleeding gums when you brush? Swelling? A strange taste in your mouth? These aren't just signs of aging. They're your body's quiet way of asking for help. And the sooner you listen, the more likely you are to avoid what Sylvia nearly faced. Don't wait. Your mouth could be whispering the first signs of something your heart can't afford to ignore. Mistake number 2. Skipping baths and ignoring what your skin is trying to tell you. Let me ask you something personal. How often are you bathing these days? It's okay to be honest. A lot of older adults gradually cut back on bathing as time goes on. Maybe it feels like a chore. Maybe, like Clarence, you're just trying to avoid drying out your skin during the colder months. But here's the thing, your skin isn't just a surface, it's your largest organ, and one of the body's earliest messengers when something's not right on the inside. Changes in your skin, like unusual dryness, discoloration, or itching, can show up long before any symptoms appear in a blood test or a scan. In fact, doctors at the Mayo Clinic have found that nearly 40% of serious medical conditions in older patients could have been caught earlier just by paying closer attention to the skin. Clarence was 77, a retired postal worker from Michigan. He thought bathing once a week was fine, but during a regular checkup, his doctor noticed a small patch of skin that looked off. That single observation led to a test, and that test revealed early stage kidney disease. It wasn't that Clarence had poor hygiene. It's just that without regular bathing, the warning signs stayed hidden. So what can you do? Set a simple bathing routine. Try to bathe at least 3 times a week, even if you're not very active. Use a gentle, fragrance-free soap to protect your skin's natural oils. Right after bathing, while your skin is still slightly damp, apply a light moisturizer. That helps seal in hydration and keeps your skin strong. But most importantly, pay attention. Every few days, take a moment to look closely at your skin. Are there dry, flaky patches? Changes in color or texture? Spots that itch more than usual? These aren't just surface-level issues. They could be quiet signals that something deeper needs your attention. And the sooner you notice them, the better your chances of staying ahead of whatever's going on beneath the surface. Mistake number 3, ignoring nail care. Take a moment right now to look at your fingernails and toenails. What do you see? Are they trimmed neatly? Are they clean underneath? Free from discoloration? You might be surprised to hear this, but your nails are one of the first things doctors look at during a checkup. That's because your nails can reveal far more than you think. In fact, they're like little windows into your overall health. According to the American Academy of Dermatology, changes in your nails can signal more than 20 different health issues, things like anemia, thyroid imbalance, even heart disease. And here's something important. For adults over 65, research shows that nearly 30% of undiagnosed conditions were first flagged because of nail abnormalities. Let me tell you about Beatrice. She's 82 years old. She didn't think much of her thick, yellow toenails. She simply stopped wearing sandals and kept her feet hidden in closed shoes. I figured it was just part of getting older, she said. But when foot pain finally sent her to a podiatrist, the truth came out. She had a fungal infection, one that had quietly spread for so long, it revealed a dangerously weakened immune system. Further testing uncovered an underlying health condition that needed immediate attention. And it had been there all along, hiding in plain sight. So what should you do? Start by trimming your nails regularly. Cut them straight across, with slightly rounded corners to help prevent ingrown nails. Keep your nails clean and dry. Wear breathable shoes, and change your socks every day. But here's the key. Don't brush off changes in color, texture, or thickness. If your nails are brittle, discolored, or unusually thick, don't ignore it. It's not just age. It's your body trying to get your attention. And the real question is, will you listen before it's too late? Mistake number 4, hiding incontinence instead of treating it. This might be the most surprising hygiene mistake of all. Not because it's rare, but because it's so common and so often hidden. More than half of seniors are quietly living with some form of incontinence. That means occasional leakage, frequent urges, or trouble making it to the bathroom in time. But here's the real danger. Many choose to hide it. They don't ask for help. They try to manage it alone, with paper towels, extra clothing, or silent worry. And that silence comes at a cost. Urologists at Johns Hopkins Medicine report that untreated incontinence can lead to serious problems, like painful skin infections, dangerous falls, emotional isolation, and even missed diagnoses of conditions like bladder or prostate cancer. In contrast, seniors who properly manage incontinence are shown to have 60% fewer complications than those who try to hide it. Let me share Douglas's story. Douglas is 73, a retired accountant from Arizona. He was too embarrassed to bring up his leakage with his doctor. So he handled it quietly, changing clothes more often, using makeshift padding, hoping it would go away. But after painful sores developed, he finally sought help. The diagnosis? an advanced prostate condition that could have been treated months earlier if he'd spoken up. My pride nearly cost me my life, Douglas admitted. I wish I had just said something at the first sign. So what should you do if this sounds familiar? First, please know this. You are not alone, and you have absolutely nothing to be ashamed of. Doctors see this every single day, and they want to help. Use products made specifically for incontinence. They're designed for your comfort and protection. Change them promptly when wet and follow a gentle cleansing routine to protect your skin. And most importantly, don't assume this is just part of getting older. Incontinence is often a signal, a symptom, a warning that something deeper may be happening in your body. Are you noticing leaks? Planning your outings based on where the bathrooms are? Using towels or pads not meant for this? Don't wait. Talk to your doctor. Because in this case, staying silent could be the most dangerous choice of all. Mistake number 5, damaging your ears without even realizing it. Let me ask you something that most people never think twice about. How do you clean your ears? Be honest with yourself. Are you using cotton swabs? Are you inserting them deep into your ear canal? If so, you're not alone, but you're also making a mistake that could seriously harm your hearing. Every day, countless older adults damage their ears without realizing it. And even worse, they miss early signs of serious infections. Doctors at the Cleveland Clinic have seen it again and again. Seniors using cotton swabs the wrong way, ending up with infections, irritation, or even permanent injury. Their research shows that nearly 40% of ear canal injuries in people over 65 come from improper ear cleaning. And many of those injuries could have been completely avoided. Let me tell you about Patricia. She's 71, a retired librarian from Washington. She'd been cleaning her ears with cotton swabs for years because no one had ever told her not to. But one day, she pushed just a little too far. She punctured her eardrum. The damage led to a severe infection that spread to nearby tissue. It was painful. It required emergency treatment. And sadly, the hearing loss she experienced was permanent. All because of a habit that seemed harmless. So what's the right way to care for your ears? Here's a simple rule to remember. Never put anything smaller than your elbow into your ear canal. That's not a joke. It's a rule every ear doctor stands by. Instead, clean only the outer part of your ear with a warm, damp cloth. If you feel like there's too much wax, don't dig. Use drops designed to soften earwax, and always follow the instructions carefully. And if you notice pain, discharge, itching, or sudden changes in your hearing, don't try to fix it yourself. See a doctor right away. Your ears are delicate, and your hearing, it's one of the most precious gifts you have, especially as you get older. So take care of it the right way. Mistake number 6, overlooking your feet and missing what they're trying to tell you. When was the last time you really looked at your feet? I don't mean a quick glance when putting on your shoes. I mean a full inspection, between the toes, around the heels, across the soles. Because here's the truth, your feet are full of clues. Doctors often check them first during senior checkups, and for good reason. Your feet can reveal early signs of problems in your circulation, your nerves, and your blood sugar. Podiatrists from the American Podiatric Medical Association say that foot hygiene issues often signal the very first signs of diabetes, neuropathy, or vascular disease. And here's a number you may find hard to believe. Up to 85% of diabetes-related amputations could be prevented, simply through regular foot care and inspection. That's not a typo. That's not a typo. 85%. Let me tell you about Raymond. He's 76, a retired factory worker from Illinois. Raymond had dry, cracked feet, a few cuts here and there. He figured it was just age catching up with him. My feet had looked rough for years, he said. But during a routine checkup, his doctor took one look and ordered a blood test. Turns out, Raymond was in the early stages of diabetes. Had they waited longer, the damage might have become irreversible. But because they caught it early, lifestyle changes were still possible. And meaningful. Raymond later told me, if my doctor hadn't checked my feet, I probably wouldn't have known for years. So what should you do? Starting today? Wash your feet every day. Then dry them completely, especially between the toes, where fungus loves to grow. Look closely for any cuts, sores, color changes, or swelling. Wear clean, dry socks made of natural fibers or moisture-wicking fabric. Apply moisturizer to dry areas, but never between the toes. And above all, don't ignore pain, numbness, or wounds that just won't heal. These are not minor problems. They may be your body's early warning signals. Are your feet dry or cracked? Have you noticed any cuts that seem slow to heal? Any strange color changes or loss of sensation? These aren't just cosmetic issues. They could be signs of something much more serious. So pay attention and take care, because your feet aren't just carrying you, they're speaking to you. You just have to know how to listen. Mistake number 7: overlooking hygiene changes caused by medication. Are you currently taking more than one medication? If so, have you noticed anything different lately, like a change in your body odor, how much you sweat, or even dryness in your mouth? You might assume it's just part of aging, but it may not be. Some of the medications that are helping you live longer could also be quietly triggering hygiene related side effects. And those side effects can be early signs of something more serious. Pharmacologists at the American Geriatric Society have found that many commonly prescribed medications can lead to symptoms like dry mouth, increased sweating, or unusual changes in body odor. And often, these signs show up before any major symptoms appear. In fact, their research shows that nearly 40% of drug related health issues in older adults first appear as hygiene changes. Let me tell you about Barbara. She's 67, a retired nurse from Florida. She bathed daily, used deodorant, and took pride in her cleanliness. But her family started noticing a strange body odor and quietly assumed she wasn't washing well. The truth? Her doctor eventually discovered that the smell wasn't coming from her hygiene, but from inside her body. It was a toxic buildup caused by medication, and it was slowly damaging her liver. Barbara said, "I had no idea. I thought I was doing everything right. But it wasn't about soap or showers. It was something I couldn't see." So, what can you do to protect yourself? Start by tracking your hygiene changes when you begin any new medication. Write down if you notice shifts in body odor, skin dryness, sweat levels, or anything that just feels off. Drink plenty of water unless your doctor advises otherwise, and always report unusual symptoms right away. And here's the most important part: never change your dosage on your own. Even if you think your medication is causing a problem, talk to your doctor first, because the side effects may be a warning your body is giving you before something more dangerous sets in. Have you been noticing odd changes, like a smell that won't go away, sweat that seems unusual, or a sticky, dry mouth that wasn't there before? Don't chalk it up to just getting older. It might be your body trying to protect you. Now you know the 7 critical hygiene mistakes that doctors often notice right away in older adults. And more importantly, you know what to do about them. Each of these changes, even the ones that seem small, could be your body's quiet way of asking for help. By addressing them early, you're not just taking care of your hygiene, you're protecting your health, your independence, and your dignity. And in some cases, you may even be saving your own life. If this video spoke to you, if you saw yourself or someone you love in these stories, go ahead and tap the like button. It helps us reach more people who need this message. Has your doctor ever pointed out one of these hygiene signs? Share your story in the comments. You never know who it might help. And don't forget to subscribe and hit the bell. We're sharing more simple, life-saving health tips every week. Please share this video with someone you care about, especially if they're over 60, because this kind of knowledge really can change everything.